My name is Mike Blivis. I am the president of Sesame Society of Ultrasound Medical Education. I wear a bunch of other hats as well. But myself and Paul were asked to moderate track number 3. And we were tasked with promoting or looking at ultrasound first in the clinical settings. We had 3 different topics, and I think we came up with just 14 slides, so we'll be out of here by 6:30, there's no doubt. I think we'll move a lot faster than that. So there were some really good discussions, and we came up with some great ideas. Also realized that there were multiple different perspectives involved, and almost all of us had things to learn. So for our first, there we go, guiding questions, we had 4 of them. What is the role of healthcare providers and industry in promoting ultrasound first? How can we improve healthcare provider awareness of ultrasound as an option, and how can protocols be developed? And lastly, how is technical advancement likely to reduce barriers to the use of ultrasound first? And for what is the role of healthcare workers and industry in promoting ultrasound first, we had just a wealth of ideas that everyone in the room contributed. One of the main themes was education, and it's education at all levels, not only educating ourselves further, but our colleagues. Also making sure that you look at any referral pattern or established referral type of tree, so that everyone who is referring patients to somebody else for imaging is aware that ultrasound may be used in some cases. When is it great as a first choice? When is it not? And also, perhaps for those point-of-care ultrasound users, educating folks that don't know anything about point-of-care ultrasound that may be an option. The other thing is trying to get education down into the base levels, and that often means medical schools, residency, and we spent a great deal of time talking about how to educate the youngest healthcare professionals so that education would kind of grow through the entire system. But clearly, we also need to educate the public, and we talked about that, whether it's multimedia, social media, traditional media. There's a great lack of awareness, and in fact, one person pointed out that many in the lay public feel ultrasound is an old technology, which I was just awestruck by this and realized, why not? Because to many of us, it is the latest, greatest, because we're aware of the latest, greatest that's happening with ultrasound. But people may not be. They may automatically think CT is the latest and greatest, or MRI. So we really have education to do throughout. And this burden falls on us, our partners in industry, and really anyone involved with ultrasound on either end of it. Sorry, how do we inform the industry in general? There's just enough delay in this that I keep getting ahead of it. And how do we inform them about ultrasound first and when? And it was clear that this was also somewhat of a complex message to deliver. You couldn't just put it into a resource information bank or anything like that. You had to target different populations. And again, that consisted of primary care providers, specialists, each of our own societies, to make sure that our colleagues understood when ultrasound could be used. Also teach future users of ultrasound. And again, you had to get a very concise message out to patients. Here's a nice graph that Paul made for us that effectively, I don't know if you can see it, but the laser pointed, the graph on the right, that if we don't keep the message very simple, both to our colleagues but also to the lay public, the message will be lost. In fact, the up curve, or the left curve pointing up, is at about 30 seconds of information. You've taught them something. Then at 3 minutes of information is the bottom, is the curve swinging down again in green. And finally, you make headway again at 30 days. So we will not have 30 minutes, we'll not have 30 days, and we really need to deliver a very concise message within 30 seconds, whether that's somehow in a billboard in 10 words or less, in a commercial, all of these things. They have to be simple. And it's clear that we may not be able to get away with just saying ultrasound is very good, and then list the however many applications we can come up with. Probably we need to target specific audiences individually, say, for breast, this is why it's great. For thyroid, this is why it's great. For your cardiac arrest, although patients don't get to select when they have those. Nonetheless, drill it down to individual patient populations, individual provider groups, so that the message can be delivered clearly, concisely, and very quickly. Otherwise, you will overwhelm people with information and they'll simply turn off. And I think we all see this all the time when government gives us big lectures, or industry gives us big lectures, or commercials that are too long, infomercials for one thing. We need to educate patients on why we feel ultrasound is the best choice. The thought was also, do we market, and there's some controversy about this, do we market ultrasound kind of like drug companies do very well? And there was opinions on both sides of that, because is that effective or not? Should we not market it quite so commercially? Clearly, more conferences with stakeholders are needed, and not just everyone that's in this room, but a lot of the groups that are missing from this room, and that's thought to be more of the lay public, perhaps, even more insurers, other decision makers. But it's thought that we need to expand beyond even all the many varied groups we've invited so far, and learn from things like Are You Dense, Get With the Guidelines, and other campaigns that have been run by societies to educate public and also educate healthcare providers. All right. Paul, do you want to run the last two?
I suppose. So we talked a lot about where technology plays a role, and curiously, you might think that the whole discussion would be let's have more technology on the one hand, or let's have less technology. It was pretty evident that you've got Moore's law that drives computers. You're seeing it in ultrasound as well, as you get more and more ultrasound for less and less dollar in the end, and actually less and less weight. We had an interesting discussion about size of ultrasound machines. At what point does it get too small, and at what point do you need to nail it to the floor so it doesn't walk away, and cart-based and that sort of thing. What was very interesting also was that the technology development was way ahead of the reimbursement development and understanding how we pay for the technology as it comes. And then there was a long discussion about how do we make the ultrasound easier to use, and how do we have a device that's both appropriate for the wedding photographer who wants to tweak every little piece of this, and for the point-and-shoot photographer who just simply needs to get to a quick clinical decision. And we talked about, at one point, an ultrasound machine that had an on button, more and less, as sort of the three buttons that might be on the machine. And is that appropriate under certain settings? Where does automation fit into this? Really interesting conversation about, for the novice user, should we have reference images on the ultrasound devices? So should we have what normal looks like and you try to shoot towards normal? Or should we have some reference abnormal images? And there was a lot of enthusiasm in that conversation until the attorneys walked in the room. And then we started to talk about legal liability and how that might really fit into that. But still this need for sort of point of use education. And do you educate as you scan? And how does that fit together as part of the device? A bit of a question about documentation, and even how technology might play a role in reducing the burden of documentation, knowing that that still is important for not only having good clinical care, but also making sure that we've got a good paper trail as we go through it. And then interesting debate around standardization of the interface. One company calls it a purple button, and somebody else calls it, I don't know, lavender. And there's a whole kind of debate about whether we should start to standardize what things are called, standardize their location, put them in place. And at the same time, there's all kinds of pressures commercially not to do that, because standardization equals commoditization. And how do we keep the value in the device and keep pushing for innovation? So it's a very interesting dialogue around technology. I think the one thing we would say is it certainly plays a role, and the question is how to use it well. That's it.